हेलो स्टूडेंट्स, आज हम देखेंगे क्लबिंग के बारे में। सो डेफिनेशन, इट इज द bulbous enlargement of distal segments of digits with subsequent loss of normal angle between the nail and the nail bed. So what are its diagnostic features? There will be loss of hyponychial angle, that is the angle between your nail and the nail bed. Then there will be fluctuance of the nail. Then there will be abnormal phalangeal depth ratio. What is fluctuance? If you hold your nail, a normal nail will not move, but if there is fluctuance, your nail will move over the nail bed. Then abnormal phalangeal depth ratio, since there is bulbous enlargement of the distal part of your finger, the phalangeal depth will increase. Let's see now some theories related to clubbing. There are theories like platelet derived growth factor, neurogenic theory, या फिर hypoxic factor, or any circulating vasodilators. So platelet derived growth factor, actually what happens, some megakaryocytes preferably lodge in the tip of your digits. So they release platelet derived growth factor and vascular endothelial growth factor. That increases endothelial permeability and causes proliferation of the connective tissue cells like fibroblasts. Neurogenic, if there is persistent vagal stimulation, there will be vasodilation and clogging. Example, lung carcinoma. Then hypoxic, if there hypoxic happens, arteriovenous fistula will be open and clogging will occur. Then there are some vasodilating circulating vasodilators like your ferritin, prostaglandin, bradykinin, adenine, या फिर 5-hydroxytryptamine. What happens? Normally, when they pass through the lungs in blood, they get inactivated. But in some patients where there is right to left shunt, the blood from the right ventricle doesn't go to lungs, so they escape the inactivation process which happens in your lungs. So obviously they will cause vasodilation and clogging. Now let's see grading of clogging. It has 5 grades. Grade 1, there will be increased fluctuation of nail bed. What happens actually? Your root of the nail plate is adherent to the bone of the distal part. But due to the connective tissue and edema that happens in your clogging, the nail root gets separated from the bone, so that when you press over the nail plate, it moves. But actually that doesn't happen. Grade 2, loss of onychonychial angle, that is the angle between your nail and the nail bed, which is normally less than 180, but in this scenario it will be more than 180. Profile side, Sambrat side. What is profile side? If you see your phalanx from the side view, it will appear convex and dome-like. Obviously, since nail has enlarged. Then Sambrat side, if you approximate 2 fingers, there will be diamond spits, diamonds-like shape separating them. Grade 3, parrot beaking. That means the nail will curve downward and drumstick finger-like appearance will happen. In grade 4, there is pain along the distal ends of long bone due to subperiosteal new bone formation. Grade 5, there will be plushy changes in your nails at the adjacent skin with some longitudinal striation. now see causes of clotting. It includes respiratory causes, cardiac causes, gastrointestinal causes, and neurological causes. In respiratory causes, there will be malignancy, suppurative lung disease, interstitial lung disease, TB, sarcoidosis. Cardiac causes include congenital heart disease, cyanotic heart disease, acyanotic heart disease with Eisenmenger syndrome, arterial myxoma, and subacute bacterial endocarditis. Gastrointestinal causes include ulcerative colitis, Crohn's disease, primary biliary cirrhosis, hepatocellular carcinoma, chronic active hepatitis. Then neurological causes include syringomyelia, median nerve injury, or hemiplegia. Let's see some atypical presentation. There will be acute clotting, unilateral clotting, pseudo-clotting, painful clotting, reversible clotting, unidigital clotting, differential clotting, and reverse differential clotting. Let's see their causes. Acute clotting will happen in subacute bacterial endocarditis. Unilateral clotting will be caused by hemiplegia. Pseudo-clotting caused by leprosy, leukocytic infiltration, or hyperparathyroidism. Then painful clotting happens in bronchogenic carcinoma, lung abscess. Then reversible occurring lung abscess and empyema. Unidigital clotting occurring trauma or any median nerve injury. Then differential clotting, what happens? There will be clotting in the lower limb but no upper limb involvement. It will occur in patent ductus arteriosus with reversal of shunt. Then reverse differential, upper limb will be involved, lower limb will be normal. If the condition is patent ductus arteriosus with reversal of shunt plus transposition of great arteries.